If you have dentures, you are probably wondering if it's okay to wear your dentures to bed at night. That is a good question. Most people have a legitimate reason for wanting to do that. Usually it's because they're not wanting their spouse or partner to see them without their teeth, or that they even wear a denture. For others, it's because they're concerned that their appearance may be affected when they sleep. And for others, they like to keep their dentures in because it makes them feel secure, kind of like the way they felt when they had their own natural teeth. Although all of these are valid reasons, here are a few reasons why wearing a denture to bed might not be the best thing for you. You see, the skin in your mouth is no different than the skin in the rest of your body. It needs to be kept clean, and it needs to breathe. When you wear a denture, your denture gets pressed up against your skin, and because your denture is essentially a piece of molded plastic, your skin gets trapped beneath the plastic for the entire time you wear it. As you can see, having your skin stuck under a denture is no different than having a plastic bag wrapped around your hand. And if you were to leave that plastic bag wrapped around your hand for a long period of time, day after day, without taking it off, you would probably notice the skin to get moist and dirty. And eventually, the skin would begin to break out, followed by infection, mold, rashes, and ulcers. All this happened because, like your hand, your mouth contains living skin, and that skin lives in an environment that is moist, warm, and full of bacteria. This kind of environment is ideal for bacteria to survive and multiply. Add food to the mix, and you have a perfect condition for bacterial infection, especially if you seal it all up in a plastic container. So, if you keep your denture in for a long period of time, you can get an infection, whether it's bacterial, fungal, or both. Although wearing a denture full-time may not be a good idea, there are a couple of strategies you could use. For one, it's a good idea to remove your denture and clean it several times a day, and do this regularly. By keeping your denture surface clean, especially the part that presses up against your skin, you can reduce the risk of infection. The simple act of brushing interferes with the bacteria's ability to colonize the plastic surface. Fewer bacteria means fewer opportunities for infection to start. Another strategy you could use to allow you to wear your denture at night is to take a break from your denture a few times a day. It doesn't have to be for a long time either. If you could find time to take a break, maybe 2 to 3 times each day, where you're by yourself and there's no one around, you could take your denture out, clean it, set it aside, and simply let your mouth take a breather. If you exercise these strategies, you will be more successful when wearing your denture to sleep at night. Of course, it would be better to leave your denture out entirely when sleeping, but if that is not an option, then this would be the next best thing. I hope you found these tips helpful. For more tips, strategies, and options when it comes to denture and denture-related problems, visit us at goodbyedentures.ca.